L'occasion est donnée là de parler davantage avec le docteur Ngo, Valérie Ngo. Il est Senior Head Researcher at the CAFU Policy Institute. Bonsoir, bonjour.
Bonjour, Claudia.
Bienvenue sur ce plateau.
Thank you and for inviting me.
Okay, today we will talk about this application. I call it BornFyne. BornFyne. It's true, I've never heard about it, but now is the moment to inform everybody, to inform me also about this application. So you will talk about this project and permit us to understand better concerning this application.
All right, thank you, Claudia. BornFyne actually is an appellation that was coined from the pidgin word, BornFyne. It's brought from pidgin.
Yeah.
So yeah, kind of wishing somebody to deliver well. And it's a project that was launched in Cameroon in 2021, and in 2022, sorry. And the project has actually been doing a lot of work in the field. We actually started the project as far back as 2018, where they did a pilot study in Balinyonga in the Northwest Division. And this project is actually funded by Grand Challenge Canada. And the project is owned by University of Ottawa. And we are collaborating. When I say we, I mean us at the CAFU Policy Institute, which is a think tank at the Dennis and Lenora Foretia Foundation to implement the project here in Cameroon. We also have other collaborators like the Donwell system located in Belgium, and then we also have CIRES, who are actually based in Akonolinga. So BornFyne actually is a two-way digital health program and project. When I say two-way, it means it enables the pregnant women and the doctors to have a communication 24/7, meaning at any time of the day, night, or whichever moment it could be, they have that direct communication regarding the pregnancy. So it's a mobile application which is actually installed into the phone of pregnant women, and then we link them up to where they're actually conducting their antenatal care services, and they are able to communicate directly with their doctors whenever there is a need.
You see many women like this application, Kade, because we know we have some region where women are not used to go and consult doctor even when they are pregnant. It's not easy for them to go and meet the doctor, to pass through all the exams. Then the day when she has to put to birth is difficult, because we can have some complication, because she did not pass through all those examinations. So what are your strategy? Tell me about your strategy to convince those women to go closer to subscribe to the application.
All right, thank you. One very interesting thing is that probably the name of the project BornFyne was actually it came from the people themselves. Pregnant women, when they did the pilot study, they were very excited, and they brought that name BornFyne. So the name is very exciting to so many people on social media. When you come across that name BornFyne, people are very interested to know what BornFyne is all about. That is one of the things that actually, first of all, I could say, speak loud for itself. And then we do a lot of advocacy. We work with healthcare providers. We work with community health workers. We also work with administrative leaders in various districts. And there's this continuous training, workshops, and then we do a lot of advocacies that are actually bringing people closer to antenatal care services in the various hospitals where we do BornFyne. And then the innovative aspect of the project itself is very attractive. Pregnant women now are no longer scared. They know that even if they go for antenatal care once in a month, within that period where they don't go for checkup, they still have a direct communication with their doctor. So that has actually encouraged so many women to enroll into the project. Presently, we have more than 450 pregnant women who are currently enrolled in the southwest region, that is Tiko and Bangem, and in the central region, Akonolinga and Ayos.
So only two regions.
Yes,
What about those those people from the far north? Because they are most of them are those people that was describing refusing to go towards the doctor to check.
Just like I said before, it's a project that started as a pilot study in Bali, in the Northwest region, and then the funders, which is Grand Challenge Canada, decided to actually proceed to further fund the project into what we call transition to scale stage 1. So we are actually trying to test the project after the very successful result we got in the Northwest. So it came upon us to take the project to another English-speaking region. This time was Southwest, and then we had to also, the funder also had to include a French region this time, which is the central region. So the project gradually, we work very closely with the Ministry of Public Health, trying to present our result and our finding. And we are hoping that at the end of the project, which is going to be in September, we are going to come out with very significant finding that could also further bring on more investors that will take the project to other regions. So we are actually progressing. After this first transition to scale, we see how the project can go to many other regions and communities as well.
So who is the brain behind that project? Yeah,
the brain behind this project actually is a Cameroonian based at the University of Ottawa. She's called Miriam Kangu. She's also a researcher as well. The project actually, like I said, was delivered at the University of Ottawa, and then they have to collaborate with the Dennis and Lenora Foreta Foundation here in Cameroon to implement the project. And then we also have Cires in Akonolinga and the Donwest system who are actually designing the app. So the project is being funded by Grand Challenge Canada. So I think those are the I could say high-level stakeholders involved in the project.
So what are the challenges you face? Maybe you say that you cover 2 regions already. So what are the challenges? Maybe you want to extend your plan of action or what?
Yeah, some of the challenges we face with BornFyne basically are challenges that are not, not new to Cameroon. One of it is the fact that we have unstable electricity supply. So because of that, sometimes women may not have their phone charge, or they have facilities that are actually in direct communication with these pregnant women may not have electricity at the time when the women actually send a signal. Then we also have poor internet connection in some areas. Some areas don't really have access to network. Because what actually is very interesting about BornFyne is that it is a network that enables a woman, even if she's working at the farm. Let's assume a pregnant woman goes to the farm and then she encounters an emergency situation. All she just needs to do is to open her Android phone, press whatsoever emergency signal that appears, and then the signal goes directly to her health facility, and then there is going to be a rescue. We have a transporter network which we have actually set in place. So as soon as an emergency is triggered, the transporter network automatically also is informed, and then they use the GPS coordinate to locate wherever the woman is. So it's one of those aspects that needs that constant internet communication. So we have had some series of women having emergency, but the signal could not get to the health facility because the internet network at that moment was a little bit poor. And then we could also see some women, because the BornFyne app has about 6 features. You have what we call the pain feature, you have the emergency and medical advice, family planning, postnatal and antenatal feature. So there are 6 features. So women, pregnant women are always found within this feature. So if a woman is feeling pain, she just open the app and press pain. Signal goes to the hospital where she's receiving antenatal care, and immediately the healthcare provider or the doctor or nurse immediately respond by calling the woman to intervene. So these things, some of them need credit for you to be able to run the services. So women in some areas actually don't have what it takes to afford credit. So then there are other issues relating to road transportation issues. The network, the road network to wherever the woman will be located may be poor. So at that moment, we may have to use that motorbikes as a transport system.
It's not really easy. But what can you say to those women who haven't yet enrolled on this platform? This boy,
Yeah, I think
BornFyne.
yes, BornFyne, deliver well. So one thing I can actually say is that women who actually have not enrolled are missing a lot, because a part of the fact that BornFyne keeps you in direct check with your healthcare, and we anticipate that whenever there is going to be any issue relating to their pregnancy, that is identified early, and then there's going to be prompt intervention. So I think women who have not yet been enrolled are missing a lot. And then one also interesting thing is that in areas of emergency, BornFyne provides free transportation for pregnant women to the hospital and back. So if you have an emergency, you are guaranteed that you will get to the hospital, something will be done, and then you'll be taken back home. So I think if you are not if you are not enrolled in BornFyne, probably you're missing a lot of issues that will guarantee the success for your pregnancy.
That's really a good project, chers téléspectateurs, justement accompagner la femme durant son moment le plus difficile, je voudrais dire ce moment pénible et qu'est l'accouchement, mais un moment également joyeux parce qu'elle donne la vie à un être. Il faudrait accompagner cette femme. Vivement que ce projet touche également les populations du Nord, du Grand Nord, parce que justement ils sont encore réfractaires justement à la consultation seulement du côté de la brique où j'étais hier. Il est difficile pour les femmes de venir se faire consulter, de suivre les différents rendez-vous du médecin, parce que non, c'est pas d'abord un homme qui doit toucher, en plus elles n'ont pas cette culture. Donc justement c'est toute une lutte qui doit être engagée de ce côté-là. Dans tous les cas, lorsque le bébé est né, il faut également accompagner le bébé durant sa période, qu'il soit à partir du moment où il naît. Il y a le temps où il commence à téter, il quitte le sein, il grandit, il est sévré. Et il y a beaucoup d'autres maladies qui rencontrent son chemin pendant ce trajet. Parmi ces maladies, on compte bien sûr la rougeole. Et nous allons en parler de fond en comble, fidèles téléspectateurs, avec le médecin qui s'est déplacé. Prenons juste cette transition et puis on revient.